now going to have another series of short lightning talks, starting with Kerry Ryder, a senior manager in research and evidence at the Health Service Executive, also known as the HSE. Kerry has a track record of leading impactful, data-driven healthcare innovations, including playing a pivotal role in designing national systems for Ireland's COVID-19 vaccination programme. Unsurprisingly, that work has earned her many rewards, and she is passionate about harnessing the power of data to improve patient outcomes and healthcare delivery in a way that is not only evidence-based, but also ethical. So welcome, Kerry.
Going to need a slide. I've got a... I'm a really fast speaker. Look at me go. No. Next. Yeah. That's me. Yeah. Forward. Don't start me until now on my 10 minutes. Good morning, everybody, and thank you to the panelists. That was a fantastic discussion, and thank you so much for this talks that you've given us so far. My name's Kerry Ryder, and I'm talking to you today about integrating vaccination data, cervical check data, and individual health identifier data to deliver on the plan to eradicate cervical cancer by 2030 in Ireland. I was one of 2 people in the national immunisation looking after the national school vaccination system prior to developing COVID-19 system with some of the people that you've already heard from this morning. We're working off those relationships today, volunteering for your benefit, collaborating for your benefit. My message to you is to choose to be data science collaborators, not competitors. We know as women that we build a better society by sharing, and I'm asking, can you lead the way on this in the workplace as well? Cervical cancer is one of the most preventable and treatable types of cancer, yet in 2020, according to the World Health Organization, more than 500,000 people were diagnosed with cervical cancer last year, and more than half of those will die. As reported by the World Health Organization, this presentation is about women in data. It's a population-based service where both the records and the missing records represent women. All countries struggle to resource preventative healthcare. In this picture, you can see one approach to record keeping is to colour fingernails to indicate vaccination has occurred, because there's no digital record in some countries. We struggle with digital coverage and vaccine acceptance in countries, and Ireland is the same resource problems, same hesitancy problems. In my experience, being curious about the process by which you gather the data is your key to improving it as data scientists. Ireland offers free childhood vaccinations and free cervical screening services. Free cervical screening services to all of you. In 2008, the National Cervical Screening Programme was established to provide a service to women and people with the cervix aged 25 to 65 who are sexually active. Just over 250,000 people, that is, annually in Ireland. And today, they're reporting that we have nearly an 80% uptake on that service. The data collected includes your demographics, your phone number, PPS number, surname at birth, your mother's maiden name, as well as cervical screening history, test results, and screening samples. The screening program checks for the presence of HPV and then incrementally, if it's finding results, gives you more detailed tests, and then a treatment plan if necessary. In 2010, the NIO introduced HP vaccination for secondary schoolgirls, about 30,000 of them annually, and then more latterly to boys, so 60,000 annually. To avail of the service, a blank form is handed to a school child, put in the school bag, brought home, parents sign it, back in the school bag, back to the vaccinator in the school who fills in all the details by hand. And the data is entered then retrospectively by the administrators in the service, AI maybe. So reporting uptake lags the delivery of the service sometimes by 2 years. The data entered is your demographic data, consent data, the vaccine status. That's changed 2 or 3 times since we started collecting it. And uptake in that service is now also at 80%. Careful listening to people about their process of data collection enables you to develop your instincts for how to bring about data quality improvement. In 2014, the Health Identifiers Act enabled an individual health identifier number for all residents in Ireland for use across both private and public sector settings. Your IHI is unique to you. It's sensitive to your demographic changes, and it stays with you for life. Achieving an IHI fits the person, proves the identity of the person, a bit like a passport. So an IHI overcomes the borrowing of someone's dose or service. And from everyone's perspective, achieving confidence, therefore, about identity and population-based service is essential to us all. The data scientists in our services were the first to realise the value of IHI. And in healthcare, I find that my understanding of priority and my capability to explain it to the front line, you know, what the back office needs, is kind of critical to business success. Nod if you've experienced that. A match of demographic identifier and a match of a demographic and an identifier like a PPSN or a mother's birth surname or an air code requires your data set to be passed through algorithms which score a likely match, and those algorithms match exactly or close matches or phonetic matches or matches like common diminutive names for children. They yield a high score, and that score has to be contrasted against other proximal scores to determine your safe allocation of an IHI. This matching type is more reliable and flexible than a single identifier like a PPSN, although that's useful, because this matching accommodates change and those transcription errors we know happen. For unmatched record, a report summarises your common errors, and that allowed us in the service to improve our data quality approach and incrementally improve the population data set, and now it's more reliable than it's ever been. Both services, the NIO and the cervical check, achieved high match rates with the IHI team, highest they've ever seen, which was a promising foundation for integration on that IHI number. Working with others is key to your success in the future, even when you don't agree on everything, which we didn't. It's not a competition of correctness. It's not a competition of intelligence. It's a collaboration. Keep taking those steps towards partnership. So we have accuracy. Now the question was about completeness, and these types of reports that you see here are commonplace. You'd kind of assume all the data was in the same place, right? Looks coherent. However, we were disappointed to find the early on records are on a completely different platform. And I find in my experience in HSE that tenacity is a key capability for a data scientist. Our tiny team had to set off on another project to import, match, deduplicate, and test records that were really quite old. How many times have you felt overwhelmed by the size of the task ahead of you when somebody says, "Oh, just get that data"? You know. On the brink of our integration, our time was again redirected, this time by the frontline other problem that you might have noticed in that chart, the drop-off of HPV vaccinations. Ireland's fascination for social media meant that it had to go through a hard learning journey to understand who to trust for evidence. Laura Brennan became our youthful and fantastic leader who chose to spend her last days working through the media to present evidence in a new and young and successful way. Without her, many more people would be missing out on our services. With her, the volume of data could prove the value of the vaccination for cervical cancer. Our children all benefit from Laura Brennan's legacy. Finally, we were able to integrate a 12-year-old's data with her cervical records from the point where she's 25 years on, and as a result, we were able to invite nearly 8,000 new women to receive their first invitation to the service who might otherwise have been missing out, the missing women. This was not the goal of integration, but taking time to reflect allows you to see more value in your data. So in 2023, the data scientists had provided the complex project data and algorithm work to enable a sufficient high-quality data set to be matched and allow a scientist to write the science. They found a drop in high-grade cytology associated with cervical cancer, which coincided significantly with high uptake of HPV vaccination for the cohort. Excellent news. In the action plan for the elimination of cervical cancer, Colm Henry, our Chief Clinical Officer, has said, "We'll only achieve elimination by putting equity at the heart of this work. Elimination can only truly be said to have been achieved when we deliver it for every community." I believe this longitudinal record set helps us achieve a greater understanding of women missing out on both services, and I personally would love to see the service develop deprivation, family and ethnic data indicators to help us understand how a woman is missed or does not avail of the service, and understand how she impacts the decisions of the family decision making down the line. I presented this timeline. You can see that in your career, you could impact society. In your career, you could impact society. I want to leave you with these two young women. Last slide, I'm wrapping up here. Ireland is in the privileged position of being able to contribute in the international landscape on the value of HPV vaccination in eradicating cervical cancer. I've played my part as a data scientist in bringing that to fruition, and today I share that with you voluntarily. I've asked that you trust your instincts for what is right. You learn tenacity. You find your voice. You be curious about your data. You work together even when you don't agree on everything, and you take incremental steps towards your goal. My message is this: data scientists should be collaborators, not competitors. As you grow as a data science leader, can you undertake to collaborate and bring benefit back to your society? Thanks.
Thanks so